May I come in, ma'am?
Yes, come in. Take your seat.
Thank you, ma'am.
What is your roll number?
7918374.
There are how many bones in upper limb?
Ma'am, there are 64 bones in upper limb, each side consists of 32 bones.
Which bone supports the shoulder?
Clavicle, ma'am.
Can you explain the side determination of clavicle?
Ma'am, the lateral end is flat, medial end is large and quadrilateral.
What about the shaft?
It is slightly curved, convex forward and medial 2/3, and concave in lateral 1/3.
Then tell me the features of clavicle.
Here the shaft is divided into lateral 1/3 and medial 2/3. The lateral 1/3 of the shaft is flattened, and it has two borders, that is concave anterior border and convex posterior border. There are two surfaces, that is superior surface and inferior surface, which consists of conoid tubercle and trapezoid ridge. The medial 2/3 of the shaft is rounded and it has four surfaces, that is anterior surface, posterior surface, inferior surface, superior surface.
Okay, good. Tell me few points about lateral and medial end of clavicle.
The lateral end is otherwise known as acromial end, which articulates with the acromion process of scapulae. The medial end is also called sternal end, which articulates with the clavicular notch of manubrium to form sternoclavicular joint.
Very good. Which organ situated in the middle mediastinum?
Ma'am, heart.
Can you explain the function of heart?
Ma'am, heart is a conical hollow muscular organ which pumps blood to the different parts of the body. It has four chambers, that is left and right ventricle, left and right atrium. Now the blood first enters the right atrium, blood then flows through the tricuspid valve into the right ventricle. When the heart beats, the ventricle pushes blood through the pulmonic valve into the pulmonary artery. The pulmonary artery carries blood to the lungs, where it picks up oxygen and then leaves the lungs to return to the heart through the pulmonary vein. The blood enters the left atrium, then descends through the mitral valve into the left ventricle. The left ventricle then pumps blood through the aortic valve and into the aorta. From here the arteries supply blood to the other part of the body.
Very good. Which node is known as the pacemaker of the heart?
Ma'am, sinuatrial node or SA node. It generates impulses at the rate of about 60 to 70 beats per minute and initiates the heartbeat.
Very good. You may go now.
Thank you, ma'am.